Hi everyone, this is your dermatologist Dr. Bhuvanashree. In today's video, I'm going to talk something about the dark circles. I know a lot of patients are very much concerned regarding these under eye circles, otherwise called the dark circles, right? So what is exactly these dark circles and how to identify the cause of these dark circles so that you can treat the underlying cause and get rid of your problem in a proper way, right? Rather than just blindly going for some under eye creams or something without understanding the nature of your dark circles. Because to say the truth, there are a lot of reasons why you can get these dark circles. Number one, pigmentation. That is, the skin under the eye is actually dark and it is pigmented. So the reason for the pigment can be many. So one of the reasons is your allergic contact dermatitis, otherwise called the pigment contact dermatitis. We use a lot of kajal or mascara or makeup products under the eyes, right? So many a times the skin under the eye is very thin and very sensitive to a lot of these products. So it starts reacting and we get the darkness. This mainly people who usually use a lot of eyeliners, they can find out not only under the eye but also near the upper eyelash margin. There will be a dark patch. Okay, so these kind of people, you have to look back again into your beauty products and the ingredients which is present there and choose a proper product or give some holidays. Okay, if at all you can avoid certain days without them, you can just give a holiday, right? And number two reason for this pigmentation under the eyes is because of allergies. Yeah, so some people from their childhood, they have this sensation of itching near their eyes, and most of these people have a condition which is called atopy. Atopy means being more allergic. So in these people, their IgE levels, that is the immunoglobulin E levels, is high, and also they sometimes may have asthma or wheezing and skin diseases like atopic dermatitis or urticaria or rashes or mosquito bite allergies, etc. Or any of their family members might also be having. So these kind of people, they usually have this sensation of itching in their eyes. So they constantly go on rubbing their eyes, and because of that constant friction, see, wherever the skin is rubbed constantly, that place tends to become darker. I say this always to all my patients. Okay, so for example, when we were small, we used to keep our elbow on the desk and write, isn't it? And we used to develop the dark patch on that elbow. So the similar thing, whichever part of your skin you rub, you irritate, you keep on scrubbing it, etc., for a regular prolonged period of time, that area is going to get pigmented. Yes. So the next most important reason for the pigmentation under the eye is what is called acanthosis nigricans. Usually a lot of people will be complaining about dirt in the neck, dirty neck. How much ever I'm going to rub it with the soap, it's not just going away, and this kind of, a velvety, patchy, dirty with some white lines, they might have it in the underarms as well, the neck as well. Similarly, it can also occur on the forehead and also the under eye. In these areas, if you just expand the skin and see, there will be crinkling. Okay, there will be a lot of, when you expand it, the pigmentation will be gone, and when you release it, it will just go and crinkle up near the eyes. So this is what is called excess skin formation, and it's just getting folded, like when you just take a carpet and push it from both the sides, it's just going to form the waves and it's going to crinkle. That is the same mechanism that happens in this acanthosis nigricans, and just because the skin is like folding and crinkling, it appears as if there is a lot of pigmentation in that area, right? So this is mainly because of insulin resistance, that is your taking intake of a lot of high glycemic index foods or a lot of sugar containing foods like maida containing foods, and obesity, overweight, or a family history of diabetes and you're not under proper lifestyle, exercise, etc. So this is a warning sign to say that you have to check your levels of blood sugar, and not just that, even if your blood sugar levels are normal, your insulin resistance might be high. So you have to definitely check into that and make some lifestyle modifications, and you will be getting rid of that problem, right? And see, I have been talking a lot of reasons why you get dark pigmentation, that is the actual dark color of your skin, isn't it? See, dark circles is not just because of what happens in your skin. There are a lot of other reasons. So the other reason why you feel that kind of a bluish tinge sometimes under your eyes, it's not just black, it's something like a bluish greenish blue hue that you get it under your eyes. The most important reason is because some people under the eyes, they have very, very thin skin, and because of improper circulation, the blood vessels under the eye, that area shows out, and because of the showing out of the blood vessels, sometimes you might feel that bluish or greenish tinge. And in some people, because of not sleeping on time and sleeping late and watching the mobiles or the computer screens, crinkling your eye muscles, straining your eyes a lot and looking like that, what happens? The circulation doesn't happen. Okay, you're just focusing so much, and you're not just blinking around. That's what you should do, right? When you constantly focus on some place, you should just look around sometime, and you should just blink your eyes for some time. When you don't do that, what happens is the circulation in that area is just getting stagnated. So it's something like getting stagnated. Your blood is getting stagnated in that place, and what happens is all the RBCs, that is the red blood cells, when they are not moving, what happens? It breaks off. And the hemoglobin pigment, which is actually present inside the RBC, it leaks out of the capillaries and it gets converted into a brown pigment which is called hemosiderin. And this hemosiderin gets deposited under the skin. And since the area under your eyes is very, very thin, even a little bit of deposition of hemosiderin is just going to look like a very brown, very dark or brownish kind of a pigmentation. So we have specific treatments for that reduction of this hemosiderin deposition. You can even do a little bit of eye massage. Okay, you feel some points, okay, in the area where your brow is there, and in the sides, and in the area where you have that nasal bridge. Some points when you just massage or press it, you feel better, right, during a headache or something. So these are the points which you can just massage and get the circulation to go on, and this might to a certain extent help you out. And definitely drink a lot of water, and also don't skip or change your sleep cycles, and that is very, very important thing. Next, very, very important reason why you get an under eye darkness is because of your aging process. Yes, so people who hit around 25 to 30 years, they start noticing that suddenly, all of a sudden, especially the 30s, you can see, suddenly my under eye area is kind of saggy, and I'm starting to look a little dull and little droopy eyed and sleepy always and tired always. So why this kind of a look happens? This is because usually we have something which is called a small fat pad, okay, that is the periorbital fat, which is present over here, which is present just under the skin. Okay, so this little pad of fat is nice and intact as long as you're young, right? So once you start aging, and nowadays we can see this in a lot of younger people as well, starting from 20-21 years also, they are starting to develop that sagging because of overuse of mobiles and a lot of overuse of your laptops, etc. So because of that, you always keep exercising your muscles, so the fat is getting lost. Okay, your fat is getting lost, and because of the fat loss, fat actually, there is one kind of a thread, okay, there's a ligament which holds this up. Okay, you can try this at home. You can just lift it like this and see if your under eye is getting any better, right? So when you do this ligament is like holding your fat pocket nice and high. But whenever there is the hormonal imbalance, or whenever because of aging process or oxidative stress, it is reducing, this ligament, the tightness of this ligament is just getting loose, and the fat is also getting smaller and smaller and smaller. So ultimately this part just sags like this. Okay, that is the reason why you get a fold here and a fold here. Everything is one and the same. It is the same pocket of fat which was once here when you had a chubby cheek, and slowly and gradually it is just falling down like this. So that's when you form these lines here, that's when you form these fat here. Okay, this fat is like gradually gravitating downwards. Okay, so this is a most important reason. And actually in these areas, you know, there is not a real pigmentation. It is the shadow which is cast by your upper orbit. The orbital roof is casting a shadow here, and that is why this lower part looks dark. And because of the dark look, it looks as if there is a under eye pigmentation. So in these cases, if you just go and rub some under eye creams, it's not going to help you at all. So a simple trick is you can either lift here and see, or you can look up and see if you know, take a selfie, look straight, take a selfie, look up, take a selfie. So when you look up, the shadow effect is gone and the pigmentation is actually gone. So in those cases, you require a volume restoration in your under eye area, and also a little bit of cheek lifting also. So in these cases, it'll again make you look again young and active. Right? So these are certain things which you can do for your under eye area, and if at all there is any pigmentation problems, creams will definitely help you out, but you have to choose a proper cream. You can use vitamin C, proper medically prescribed vitamin C serum. Vitamin K is very important. Niacin is very helpful here, and prescription retinoid creams are very important here. You can't just pick these products from the market, because under eye is a very sensitive area, and you first of all, what is your particular concern and why you've got those under eye pigmentation has to be found out, and depending upon that, the treatment has to be targeted. And there are a lot of creams. Okay, once they mention under eye, the price is, you know, skyrocketing. So that is very important here, and you have to know what ingredient is there. You have to keep the under eye nice and moisturized, and always please don't forget to use your sunscreen till the lower lash margin. Sometimes people get irritation, watering eyes, because they put the sunscreen inside the eye. So only for the under eye area you can try the physical sunscreens which have zinc oxide and titanium dioxide. So these won't irritate your eyes much as the chemical sunscreens. So these are certain tips from my side, and take care. And under eyes are very important areas. You can help yourself look much more young and dynamic by fixing just one area if you choose. It is your under eyes. Thank you, and hope you found this video informative. If you liked it, share this video with your friends, and if you have any other queries, do comment below so I can make more videos like this. Bye-bye from Dr. Bhuvanashree from Bhuvi's Dermatologist Laser Skin and Hair Clinic, Adyar, Chennai.